Hey, okay, we have page 50, practice 21, gynecology. Part A, the female reproductive system. Fallopian tube or salpinx, womb, ovary, neck of womb or cervix, and vagina. Part B, menstruation. A period is the common name of a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes as LMP 2/52 ago, meaning the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhea, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50. It's called the menopause or climatic. In everyday English, it is known as a change of life, or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats. Part C, gynecological consultation. A gynecologist is talking to a 30-year-old woman, and the gynecologist says, "Are your periods regular?" But she says, "Yes." "How often do you get them?" "Every 4 weeks." "How old were you when you started to get them?" "About 12." "When was your last period?" "A week ago." "How long do the periods last usually?" 4 or 5 days. "Would you say they are light or heavy?" "Light." "Do you get clots?" "No." "Do you get period pains?" "Not really." "Is there any discharge between the periods?" "A little." "What color is it?" "White." Part C, contraception. Part D, contraception. For women, methods to prevent pregnancy include the oral contraceptive pill known as the pill, the diaphragm, and the intrauterine device or IUD, or Cooper cord. Condoms are available for both men and women. We have the exercises for practice 21, gynecology. 21.1. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy, removing the womb or uterus. Menorrhea, heavy periods or heavy bleeding. Salpingitis, inflammation of the fallopian tube. Cervical biopsy, taking a small sample of the cervix. Read the conversation between the gynecologist and the patient in the opposite, and complete the notes about the patient. Menarche, about 12. Menstrual cycle, every 4 weeks. LMP, a week ago. Menorrhea, no, they are light. Dysmenorrhea, not really. Discharge, a little. White. 21.3. Now write the questions that the doctor asked. Look at C opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, how often do you get them? LMP, when was the last period? Menorrhea, how would you say they are light or heavy? Dysmenorrhea, do you get pain? Discharge, what color is it? 21.4. Complete the case report. One word is needed twice. Okay. Look at B and the opposite to help you. Case 15. A 45-year-old woman had been having periods lasting 4 for 8 days, with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a Cooper coil was fitted. She had had a normal pregnancy when she was 25. Here we have a couple images here. We have the diaphragm, IUD condoms, and copper coil. (22) The heart and circulation 1. Part 8. Shortness of breath. Shortness of breath or breathlessness is dysphonia. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases, it may be present even at rest. A patient who is breathless when lying flat, for example in bed, will tend to sleep raised up on 2 or more pillows. The abbreviation SOBOE or SOBOE stands for shortness of breath on exercise, or on exertion, or on effort. Patients say, "I get terribly short of breath climbing stairs." Doctor can ask, "How many pillows do you sleep on?" Part C. Heart rhythm. The normal resting heart rate is 65 less 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. The heart rhythm may be regular or irregular. In an irregular rhythm or arrhythmia, there may be early beats which interrupt the regular rhythm, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they are described and symptoms as palpitations. Case 4. A 24-year-old student was admitted to the hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath, on exertion of apnea and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes or attacks of atrial fibrillation, which had been particularly